Hi everyone, my name is Zana and I'm creating this blog today to talk to you all about the complication that I'm currently experiencing post-spinal fusion surgery. The point of the blog is not to scare anyone who is considering having spinal surgery, but to hopefully help people in the future that may come across the complication that I'm going through, as there are no records so far that I've found on the internet, and the surgeons at the hospital also don't really have any cases to compare me to. So hopefully this will give someone who's going through the same situation as me some answers and maybe a bit of comfort knowing that they're not the only one, because that is pretty much how I feel right now. Just to give you a background on everything, I was diagnosed with scoliosis when I was 9 years old. My auntie actually noticed that one of my hips seemed like it was really formed and curved normally, but the other one wasn't. It was really straight. When she brought it to my mum's attention, my mum said she knew straight away that it must be my spine. Asked me to lean forward and it was an evident S shape on my back. She immediately got me referred to the hospital, my local hospital, who unfortunately couldn't really help me any further other than telling me it was scoliosis, as they're not specialists in that field. I was then referred to Spinal in Middlesex, which is the best hospital that could be for spines, so I knew that I was going to be in safe hands. They actually advised me to wear a back brace for a period of time to hopefully slow down the curving process, because it seems to accelerate in girls as they go through puberty. And I was obviously at that age of 9-10 years old that was going to start happening. It wasn't something that I was born with. It did come about as I got to that age. So I was given this back brace, very thick, hard plastic. It came up behind me, sort of above my shoulder blades and under my bust. Had to be done up very tightly. I had to wear it for about 20 hours a day, and I wore that for 4 years, so a really long time. It was uncomfortable, and obviously at that age you're embarrassed, which is silly now. I realise at the time I was petrified that my friends would find out that I had this condition, when really when they did eventually find out, they were so supportive. So I do recommend that if you are someone going through that, don't be embarrassed. Lean on your friends to give you that support. The back brace did potentially slow the process down, but it got to the point where when I think I was year 10 at school, I couldn't do PE anymore. My ribs felt like they were compressing. I couldn't breathe in deeply and breathe out. I found it sort of very painful as well. I was always twitching and trying to click something in my back, trying to relieve the pain that I was having, which was constant. It didn't matter how many times I clicked it or went to the osteopath every week. It just didn't make a difference for the pain. So we got to the point when we had one consultation with Mr. Nordine, my doctor in Spinal. He basically said he thinks the next step would be to have the spinal surgery. At the time I was 15 years old, just turned 15, so obviously it was quite a daunting time, but also at that age I feel like I didn't really understand. I completely displaced myself from it. It wasn't happening to me. When everyone would talk about it, it didn't feel real, which was the way that I handled it. Whether that was the right thing to do, I don't know. But anyway, I was referred, and I actually went ahead and had the surgery in April 2010. I will attach the photos of my x-rays at the end of this video so that you can see exactly what I've had done. I've got 2 rods either side of my spine and about 12 screws, I think it is, in place, and it's so much straighter. As soon as I woke up, the doctors were able to tell me that Mr. Nordine had done such a great job and there wasn't any problems that they could see at the time. And as the weeks went on, I wasn't in pain anymore with my back. Obviously there was tender where I've had the operation, but pain-wise I didn't feel the need to click my back or twitch it anymore, and it was amazing. It was just like a new lease of life. I could walk again and breathe again the way that any other 15-year-old could. So I was finally discharged about 2 years ago, so that would have been 2015. I'd had no problems whatsoever. The scar, you could barely see. It was pretty much invisible. They'd done such a good job. It's just a pencil line going down my spine. Occasionally I'd get a backache. It seems to be if I do pull muscle in my back, it does seem to go into a spasm. I've probably only had that a handful of times since the surgery, but I do think that is down to me being quite lazy and not doing any exercise. If I did actually do exercise, I would be able to strengthen the muscles in my back, which I haven't done. I haven't done really any exercise since the operation, which is my fault really. I need to start building up that core strength, I now realise, because the last spasm that I had in my back, I couldn't go to work for about 5 days. And it was just excruciating. So I do recommend to keep up your fitness, because if you don't, it is painful. So last year in May, I somehow noticed that I had a lump on my back, right on the top of my spine, near where the incision actually is for the scar. And it felt like a small lump. It wasn't very noticeable. I don't know what made me feel it. Now and again I would feel my spine. I don't know why, just to check the scar, because the top of the scar where the incision is sometimes would have a bit of like dead skin on it. So I don't know if it was just checking for that, or if it was somehow my body was telling me that something wasn't right there. Anyway, I could feel that there was a small lump. I showed my boyfriend and he didn't see anything, and I thought, I can feel there's something there. When I got home and showed my mum, instantly she was like, no, that's never been there before, you know, what is this, because it's right on my scar line. So I booked a doctor's appointment to go and see one of my local GPs. She thought it was lipoma, and when she was talking about it, I was thinking it's not, because I've got a lipoma on my leg and it's completely different. She was telling me that it was soft and squidgy and it could move. It couldn't. It was rock solid, did not move. It wasn't painful or anything like that. It was just, I don't know, it wasn't very nice. It was like a lump, and it was just getting bigger as the days went on. And then the doctor, I asked for an ultrasound. She said maybe it was an abscess, just to have an ultrasound on it and see what it is. I waited a few weeks for the ultrasound. My mum managed to book me in actually for a cancellation to get things moving along quicker, because we were anxious, obviously, because it is on my spine. And we did say to the GP at the time, I think we should be referred back to Stanmore, because I had been discharged obviously about a year prior to that. But the GP said they wouldn't do that for the time being, that they would need to do some initial tests first of all to find out what exactly they're dealing with, because it might not need, you know, an orthopaedic surgeon to be looking at it. But in my gut, I knew that it was going to be something related to the surgery that I'd had, because of the placement on it of the lump. So I had my ultrasound, and the doctor there confirmed that it is an abscess, and I was given a course of antibiotics to hopefully clear it up. So after the course, it had shrunk quite considerably. It was no longer a big sort of golf ball, sort of half a golf ball size. It gone down to almost like a pea size, but it was squidgy. The top of it had gone very red, and I could tell that there was some sort of liquid that was trying to come out. And then one day I got into the shower, and I could, before the water was even running, I could feel something trickling down my back, and it had burst. All this blood and some sort of liquid pus had all come out. It was disgusting. And I thought, oh, that's good, you know, it's all come out now. Hopefully it will start to heal, which was not the case. So this was in about June 2016. I was going on holiday as well to Cyprus. So I thought, oh, it'll be good, you know, get it out in the air, but like the sun and the sea water will probably help it. and nothing changed. When I came back, it was just this little, almost like bullet wound shaped sort of hole in my spine. Nothing had changed at all. So we were referred by then to my local hospital, to a general surgeon, to see if it was something that he would be able to just cut out basically and stitch up. And I found this really upsetting because I've always been self-conscious about the scar on my back. I just thought, oh, another one, it's going to look horrible by the time that they're finished with it. And the surgeon there asked me to have a MRI just to see if they could see if it was related to the surgery that I had on my spine. When the MRI came around, that was in the October, so it's been a long period of time of waiting for the MRI, and I then had to wait 5 weeks for the MRI to be reported on. I was ringing up near enough every day asking, has it been reported on, have they got the results, not getting anywhere at all. I contacted pals to hopefully help me as well, because I was getting so frustrated by that point of why is it taking so long just to get the results from the MRI. It then was reported on 5 weeks later, to then wait another 5 weeks to go and see the general surgeon at my local hospital, who then told me that there was nothing that he could do and that he would be discharging me and sending me to Stanmore, which was really frustrating because obviously that was our first point of call and the GP wouldn't allow us to do that. And so now it's middle of October and I was actually going on holiday again in December to New York, and it worried me because I didn't quite know what it is that's going on with me, and I had to declare it on my travel insurance, not really knowing what it was. I didn't really know what to declare. I had to speak to someone to be able to declare it on the travel insurance, but not really knowing exactly what it was. And while I was in New York, I knew I was going to get ill. I had really sore throat just before I went, felt really ill and shivery. So I asked my GP if I could take a course of antibiotics with me, which they prescribed. And while I was out there, I was really ill. I had tonsillitis and a chest infection, ruined my whole trip. And the type of antibiotics that it was the first one, because by then I'd probably had about 4 courses that had done nothing to the abscess, that closed it up temporarily. When my boyfriend went to change my plaster that day, he noticed that the little hole had formed like a barrier over it. And I was so excited. I texted my mum, sent her a photo of it and said, oh, this is it. It's just maybe this antibiotic that we needed all along. But by the next day it opened again, and again didn't change at all. It stayed the same, it wasn't big, a small open wound. And it was something that I was having to dress twice a day with plasters, breathable plasters, once in the morning and then in the evening before I went to bed, because it smells really, really bad. So bad. Before I knew it smelled, I was at work going, what is that smell? Looking through my desk, in the bin, and the lady next to me was going, oh yeah, I can smell it. It doesn't smell very nice. It was only when I went into the bathroom that I realised that the smell was in the bathroom as well, and I realised it was me. And it was horrible, really horrible. And it made me so self-conscious about it, thinking, oh my God, people can smell me. If I can smell it, surely they can too. So not very nice, especially through the summer when it was hot. It was a lot worse as well. So going forward, I had a appointment at Stanmore eventually with Mr. Bhagawati, I think his name is said, because unfortunately Mr. Nordine has now semi-retired. He's not actually at the hospital seeing patients anymore. He still goes to their weekly meetings. I don't know if he's still operating on people, but as far as I know, I won't be seeing him again for a consultation. Mr. Bhagawati was really helpful. He basically said that they would be able to help me in Stanmore again and get to the bottom of it, he basically implied that there was a bug forming this abscess, an infection, that was most likely actually placed at the time of the surgery. They try obviously and try to keep everything as clean as possible, but he said, you know, with the metalwork, it only has to be out in the air and a bug can form on it, which they think is what's happened in my case. They will never know 100% what caused it, or if it was at the time of surgery or later on, but they do seem to think that it probably most likely was at the time of the surgery, which to me does make sense, because when I look back and think from the age of 15 to now 22, I've been quite a sicky teenager, always having tonsillitis, bladder infections, and my tonsils would always flare up. And I've probably had so many courses of antibiotics over the years that I just don't want to really take them anymore, because it worries me, obviously, taking that many courses. And it does make sense to think, well, if my body's always had this infection underlying all these years, that it hasn't been able to fight off smaller infections like tonsillitis. But Mr. Bhagwati, what he basically said was they have an option of either they can wash it out, they can cut away all the tissue, washing it out, but the type of bug that it most likely is one that can't be washed off. So it doesn't matter how much they scrub the metalwork, it's created like a biofilm around it, so it will always be there, and it runs the risk of having further surgery in the future. And this thought really scared me, because I thought, well, okay, it might be a small procedure now to just have it washed out for the time being, but say if it comes about in another 7 years' time, then I'll be 30, nearly 30 then, I might have children by then, you know, being a completely different situation. At the moment, I'm still living at home, I don't really have any responsibilities. My parents would be able to support me the time that I'd need to take off of work as well. So it was a tough decision sort of to make, and I came out feeling really, really sort of worried about it all. And the other option that he gave was to have the metalwork taken out, and this completely baffled me. I didn't even realise that was something that could be done. I thought it's supposed to be in there for life. Once it's in. Surely they can't remove it because the bone has formed around it. But he told me basically they chisel off the bone, and it's actually quite straightforward to take it out. This worries me also because, like I said, it was supposed to be in there for life. Surely I'd need it put back in, because your spine can curve at any stage of your life, whether it is in pregnancy or just old age, and the thought of being all crippled over and in pain again by the time I may be 50 or later on in life, it just worries me. I don't want to have to go through that, then have the surgery again at that age. It just seems silly. I'd rather get it sorted now while I'm young and don't have any responsibilities. And, you know, the younger that you are, hopefully the quicker that you recover from surgery as well. So Mr. Bhagwati basically said to go away and think about the options, and booked me in for another consultation with him that I had Monday this week. That was the 15th of May. He basically in that consultation just said the same. Had I thought any more about it? And I said in that consultation that after thinking about it, I think I'd rather have the metalwork taken out and then put back in, just to make sure that the infection is definitely gone. Because what they would do, whether they wash it out or actually take out the metalwork, they will put me on intravenous antibiotics to make sure that the infection has gone. He basically said, unfortunately, it's not that simple. It seems simple because they've already put it in once before, but to put it in again, it runs quite high risks, because the places where the screws are at the moment, they may not be able to use those screws. So, like if you put a shelf on a wall, you know when you take out that screw, it's kind of messed up the hole where that new screw needs to go. And he basically said it's very much the same as that. So they could use bigger screws, but then that runs the risk of tearing the hole. I don't know, making it obviously quite dangerous because of nerves and so on that are going through there. And I said, well, is it possible to place them differently in different parts of my spine? I haven't got any screws at the moment. And he basically said the reason why the initial placements were chosen was because the MRI or scans don't show the other places that clearly. So then again, that would be a risk, putting a screw into somewhere that they don't have, you know, they can't see that clearly really. So my brain was just whizzing everywhere. I don't know what the best thing is to do, and it seems to be that the doctors also don't have any idea really either what the best thing is to do, because he told me that I'm pretty much the only one they've ever come across that's ever had this problem. There is nothing online, there's nothing on their records. There's only a couple of similar cases that Mr. Nordine, who's a worldwide surgeon, has come across. But it seems to be I really am one in a million. Rather than being 1 in a million to win the lottery, I get this. So I have to remind myself that I'm very lucky. A lot of people are still in pain post-surgery, and I'm so thankful that I'm not. And that is something that I'm concerned about in the future. If I do have it taken out, put back in, or whatever, if they do mess around with it a bit, I'm so worried that I will be in pain again. So my brain it doesn't really know what to think at the moment. I went back to see my GP because mid-morning I'm starting to feel really sick and dizzy. I was worried that I was maybe diabetic because it runs in my family, but it was all tested and fine, thankfully. She said it probably is the infection in my body making me feel dizzy, even though I'm eating normal meals and I eat a lot. She said it probably is the infection because my CRP level is level 19 at the moment. For someone of my age, it should be between 3 and 5. So it is really elevated, and the CRP is an indicator for inflammation and infection in your body. So probably is obviously that making me feel not myself, not well. And also psychologically, it's been a long process. I've had this condition now for a year, and I still don't really feel any closer in getting a result because no one really knows what's the best course of action to take. I think psychologically it's affecting me as well because of the smell, and it's just not nice. I'm so self-conscious all the time. If I forget to change my plaster, I've done that before and had to go out for a meal, and all I can smell was this abscess, and I'm so self-conscious thinking, oh gosh, everyone else in this restaurant must be able to smell me. So I can't wait to finally get it sorted, but when that's going to be, I'm not quite sure. We then had a appointment yesterday, Friday the 19th, with the bone infection doctor. Her name was Dr. Lamb at Stanmore, and she gave me her opinion on everything and took all my notes down and how I'm feeling and how many times I've probably had tonsillitis since the operation. So it makes me think that she thinks it could be connected as well. Obviously, I've had this infection for a long time, and it's perhaps my body's not been able to fight off smaller infections. From what she was saying, though, the impression that I got, whether or not this is correct, she thinks the metalwork should be taken out. So the closest situation they're able to compare me against is hip replacements, which obviously Mr. Bhagawati explained to us and to her is obviously quite different, because with a hip replacement, if the metalwork is taken out of someone's hip, they need it put back in because they won't be able to walk without it. Whereas with your spine, what he's saying is that it should be fused now, all these years later, that I should be able to cope without it. Even though that, obviously, like I've said before, it worries me. Dr. Lamb, though, she has said as well, what they'll need to do initially is go into the tissue and take samples and grow cultures from the samples to show what type of infection and bug it is, to be able to treat it correctly with the right antibiotics. Again, whether that be just from washing it out or actually removing the metalwork, they'll need to do that either way. She said because it's only appeared 6 years, initially appeared 6 years after surgery, it may be something that they need to grow for quite a while until they get the right bug that it is. And she asked for Dr. Bhagawati to come into that consultation with us as well. And again, we sort of just spoke about the options and how I was feeling about it. And I feel like I've gone full circle, because then I said, oh, actually, I think what I would prefer to do now is just have it washed out for the time being and treated. And we can use my CRP as an indicator to see that once it's washed out, will my CRP go back to normal, to indicate that the infection is now at bay again. So I think he's probably thinking, what is this girl doing? Keeps changing my mind all the time. But it's just that I don't know. I don't know what the best decision is, and I don't want to make the wrong one. And no one else is able to really tell me what to do. I've spoke to my parents about it, and they don't know either. We're not medical professionals. So I basically said, I'm leaving it up to you doctors, because they're now going to have another meeting next Friday, and they will hopefully ultimately decide and come to a consensus, because it seems to be that the bone infection doctor and the surgeons both have different ideas and they can't quite agree on what the best course of action is to take. So they hope that they'll come to a consensus on Friday, and they will let me know what that it's going to be. And I just, more than anything, I just want to have a operation date so I can start focusing on that and thinking, okay, I'm going to be better from this date, because I feel at the moment my life has just been put on hold. I can't sort of even think about going like on a holiday or anything. I was supposed to be going to Thailand in about 2 weeks, and obviously couldn't then do that once I found out about this infection, and it's all related to my back. Especially in a place like Thailand, I wouldn't want to pick up any more bugs or infections while I was out there. So I just want to get it sorted really, and it has been such a long time. It's been a year now, so hopefully on Friday they'll be able to give me some answers, and we'll go from there. And I will post another blog to keep you updated on what they decide and how everything goes. But the purpose of this blog is not to frighten anyone who's having the surgery, who's going to have the surgery, because it was the best thing I ever done. Even with this complication, I don't regret having a surgery at all, because it's just made my life so much more comfortable, and I'm just, to not be in pain anymore is just amazing. I still can remember the pain and being so uncomfortable in the back brace and just thinking, oh, is this what my life's always going to be like? So unfortunately, I'm probably just that little 1% of people that experiences complications from the surgery, but I still know that I'm very, very lucky. So if anyone is considering having a surgery, I do really recommend it. Don't be worried, because the surgeons, they are the best, especially at Stanmore. If you're unsure what hospital to be referred to, I do really recommend Stanmore, and everything that they've done for me has just been incredible. It's just that unfortunate that the complication has happened, but it is so rare. It's so rare, and the doctors have told me that they're just baffled really by what's happened to me, because they haven't really come across it before. So don't be worried if you are going to have the surgery. But if anyone has had the surgery and finds that they are going through this complication or have had this complication, please get in touch with me. Even if it's years later after this video has been posted, I will always keep my profile active and respond to any of your comments and try and help you or give you any advice that I can really. But I don't know, there may never be anyone after me that has this complication, and I hope there isn't, because it isn't nice. But we shall see what happens. So thank you everyone for listening, for me rambling on for half an hour. But if you do have any questions, please put them in the comments and I will get back to you. Thank you.